Yes, we've now got 717 patients with COVID in hospitals across Victoria. That's the first time since February that we've hit the 700 mark, and it's also 300 cases increasing in the past 3 weeks alone, a 78% increase. So it just shows the strain that the healthcare system is under, not just here in Victoria, but during this Omicron wave that's sweeping across the nation. There are thousands that are now in hospitals across the country. And it's not just hospitals that are feeling it, it's also our ambulance service as well. As you mentioned, overnight we saw a social media message go out from Ambulance Victoria asking for the public's help to actually not call up 000 unless it was an absolute emergency, and instead calling on people to instead get in touch with Nurse on Call or their GPs or pharmacies later on. And that comes after a code red came up on Saturday night, the 7th so far this year. Now, we are hearing from epidemiologists and public health experts saying that the government messaging across all state and federal governments is really worsening at the moment in the face of this growing Omicron wave. Professor Bruce Thompson from Melbourne University School of Health Science says that we are potentially looking at that freeze on elective surgery in the future if we don't implement better COVID-safe policies. And Professor Brendan Crabb from the Burnett Institute is saying that we have collectively really gone into a strategic hole and put our heads in the sand by thinking that only using the vaccinations will get us out of these emerging Omicron strains. And they're really hoping to see other health implementing messages as well as measures like masks, perhaps rethinking that returning to the office instead of working from home, and also just really trying to make sure that people think about the fact that COVID is once again on us and have that in their minds front and centre.
And Steph, how much is this spike in RSV cases among children contributing to the pressure on hospitals?
It definitely is. We can see this RSV as well as the flu causing real problems in our hospitals. And in terms of RSV, this is a really big worry for people over in New South Wales. The New South Wales Respiratory Surveillance Report recently has found that 720 children aged under 4 were presenting to the emergency department in 1 week alone. 42% of those were so sick that they needed to be admitted to hospital, and among the young kids that was for bronchiolitis, which in infants is associated with this RSV, which can prove deadly to really young children. Infectious diseases experts say for parents who are worried out there about RSV and bronchiolitis, the symptoms are really shallow breathing, fatigue, fever, and also a cough as well. So just to be on your guard for that too, as we have lots of lurgies around this winter.
We certainly do. Steph, thank you.